What's up, party people? Hey, it's Dr. Buck again. In this video, I'm going to do a little Q&A. I'm going to do a new series called Q&A with Dr. Buck. So if you have questions for me, please leave them in the comments below. And I'm going to choose some questions each week to answer for you guys. So let's get to it. Okay, so the first question is, I'm 80, not keen on surgery at my age, do not have stones, but do have granulation on the walls. My surgeon says it sometimes end up with cancer. He has not insisted on surgery. Have we made the proper decision? So I'm assuming this is gallbladder, and this is an 80-year-old person. So if it's granulations on the walls of the gallbladder, and you can't tell it's cancer. So I'm not familiar, honestly, with granulations on the walls of the gallbladder. I'm guessing that they're saying that maybe there's some stones there. I'm also assuming that you have symptoms, that's why you're seeing somebody. So at this point, I would say if the symptoms are bad enough that they're changing your lifestyle, then I would probably proceed with it if I think that those are causing your symptoms, right? And we can't always know that, and there's a lot of other things going on, like I don't know the person's sort of physiologic status, like do they have a normal heart, do they have normal lungs, can they undergo general anesthesia, all those things go into it. I certainly have done a gallbladder surgery on patients that are 90s, I mean 92, 95, I think maybe 95 or 96 I've done them on it, something like that. But if you can do a laparoscopic procedure, most people tolerate them very well, even in your 80s and 90s. So I wouldn't be totally concerned so much about the cancer at 80. I wouldn't necessarily go after it if I just thought it was cancer. It's a tricky thing at that age, but I think it's going to have to do with the signs and symptoms you're having. Is it enough that it's bothering you on a daily or weekly basis and you really just want to get rid of the symptoms? So I hope that helps that question. Dr. Jagadesh, I hope I said that right. And how are things on the other side, away from medicine? So on the other side of away from medicine, pretty good. I don't work all the time. I'm not always stressed out. I sleep normally. It's a pretty good deal, but it's kind of like Superman taking off your cape. You don't have that superpower anymore. So you're kind of just a regular person. It's kind of weird, but I'm enjoying it. I'm doing well. I hope you're doing well too. Okay, number 3, Carib girl, I'm assuming Caribbean girl. Does the incision near the belly button hurt a lot, or could it be dangerous as it is a very sensitive area? This all depends, honestly, on the person and the surgery. It's really hard to say, does the incision hurt? Yes, it hurts somewhat. Some people have less pain than others. Some people are more stoic. Some people, the pain medication affects differently and it totally takes the pain away. Some people it doesn't. So it's really tough to answer that. If you've ever had surgery before, like maybe you could compare it to that, but it is a small incision. It's about 1 to 2 centimeters, depending on your gallbladder, your surgeon, and all those things. So it is, I would say, on a scale of 1 to 10 for surgeries and pain from incisions, it's on the lower side, 1, 2, 3 or so, and it's a pretty small incision. And then the second part of that question is like, could it be dangerous? Is a sensitive area? Then I'm assuming that like you're talking about the liver and all that stuff. Now, gallbladder surgery does carry like a 0.5% chance of injuring the common bile duct, so that can be a problem and that is dangerous. I never had one of those injuries when I was doing surgery, and I did them for 10 years, and that was one of the most common surgeries we did. So it does happen, but it's pretty low risk. And I would say gallbladder surgery in general is pretty low risk, even though you are kind of operating around a couple big structures. So I would say for the most part, gallbladder surgery is very low risk. Question number 4 is from 100 subs, no videos is their name. And it's, how exactly do I become happy? Well, I mean, I think it's fairly simple. You make enough money to buy a Porsche and drive it over 100 miles an hour. That is all there is to it. Alternatively, you could go borrow your friend's and drive it over 100 miles an hour. That may make you even more happy because you're not damaging your own car. And then lastly, Dominic Chaput, please do a car video. It's coming, bro. I'll see you in a little bit. Thank you guys for watching these videos. Subscribe to the channel if you haven't. Like the video if you like the video. And please share the video if you think it'll help somebody else. Thanks a lot, you guys.